The dying soldier grabbed her wrist with what little strength he had left. His lips were cracked, his eyes glassy, and blood was soaking through the gauze faster than anyone could replace it. The trauma room at Northgate General Hospital in Caldwell City was packed with screaming staff and flashing monitors, and nobody was doing the right thing. Then the soldier whispered one word into the ear of the blonde nurse crouching beside him. One word that made her go completely still. One word that nobody else in that room had ever been trained to fear. Specter. If you've never seen a story like this before, hit that subscribe button right now and follow along to the very end, because what happens inside this hospital is going to shake you. Drop a like and tell me in the comments what city or country you're watching from. I want to see exactly how far this story has traveled. Now, let's go. The shift started at 11, same as always. Sarah Novak clocked in 7 minutes late because the bus from the east side of Caldwell City ran behind schedule, and the shelter on Mercer Street didn't have heat, so she'd stood in the November cold longer than expected waiting for the 44 line. She didn't complain about it. She never complained about anything, which most of her coworkers had long since decided was either a character flaw or proof that she was too dim to notice when she was being treated badly. Neither was true, but Sarah had stopped explaining herself years ago. She tied her hair back in the break room, traded her coat for a set of worn navy scrubs, and pulled her badge from her locker without looking in the mirror. The badge said, Sarah Novak, RN, General Medicine, Northgate General Hospital. She clipped it to her chest, drank the rest of a cold coffee that had been sitting since her last shift, and walked out onto the floor. The emergency department at Northgate General occupied the entire east wing of the main building, a sprawling institutional space of cracked linoleum and buzzing fluorescent lights that the hospital board had been promising to renovate for 4 consecutive years. The waiting area was always full. The trauma bays were never empty. The nurses ran on caffeine and whatever personal reserves they had left after months of understaffing, and the doctors, the senior ones especially, operated with the particular brand of arrogance that only comes from never being held accountable for anything. Dr. Raymond Stahl was the worst of them. He was the chief of emergency medicine at Northgate General. A thick-necked man in his 50s with silver hair, he kept carefully styled and a way of walking through the ward that suggested he believed the floors had been installed specifically for him. He had a reputation for brilliance that was roughly 30% earned and 70% manufactured through aggressive self-promotion and a talent for taking credit from the people below him. The nursing staff called him the Wall, because talking to him was exactly like talking to one. Responses were flat, immediate, and left you feeling like you'd said nothing at all. Sarah had worked under him for 2 years. He didn't know her last name. Novak. He stopped beside her at the triage desk without looking up from his tablet. Bay 3 needs a new IV line. The one your colleague set is already occluded. I'll check it, Sarah said. I'm not asking you to check it. I'm telling you to fix it. He tapped something on his screen. And the family in Bay 6 keeps asking about discharge paperwork. Handle it. Dr. Stahl, Bay 6 is Dr. Ferretti's patient. If I access his... Are you explaining hospital hierarchy to me right now? He finally looked at her, and there was no heat in it, just mild contempt, the kind you direct at something that's mildly inconvenient rather than genuinely problematic. You're a floor nurse. Handle administrative tasks. That's the job. He walked away before she could respond. Beside her, Kira Davison, 26, 2 years out of nursing school, and still in the phase where she found Stahl charming rather than dangerous, gave Sarah a sympathetic wince. He's just stressed. Surgical board meeting tomorrow. I know, Sarah said, and moved toward Bay 3. She wasn't angry. That was the thing people misread about her. The absence of visible anger didn't mean she was fine with things, and it didn't mean she was too passive to push back. It meant she had learned a long time ago to measure when a fight was worth the cost and when it was better to pocket the energy for something that actually mattered. Right now, Bay 3 mattered. A 64-year-old with a perforated ulcer was lying there with a failed IV line and a blood pressure that had been drifting downward for the last 40 minutes. Sarah looked at the chart. She looked at the man. She looked at his hands, the way his fingers had gone slightly dusky at the tips. and she felt the quiet internal click of something recognizing something else, the kind of pattern recognition that doesn't come from textbooks. "Mr. Allard," she said, "I'm going to reset this line and then I'm going to ask you a few questions, okay? Just breathe normally." He nodded. His eyes were frightened in the way old men's eyes get when they realize that the body they've trusted for 6 decades is no longer reliable. She had the new line placed in 40 seconds. Clean stick, no fishing, no repeat attempts. She taped it down, flushed it, watched the drip rate stabilize, and then stood back and looked at the monitor. His pressure was 88/54. That was lower than the chart was showing because someone had entered the last reading incorrectly. She corrected it in the system, flagged it for the attending, and then on instinct, the same instinct that had kept her alive in places this man would never hear about, she pulled the pulse oximeter and rechecked his oxygen saturation manually. 89%. She rechecked. Same number. She reached for the call button and paged the attending directly. The attending, a young hospitalist named Dr. Reeves, who was covering 3 patients at once, arrived 4 minutes later looking harried. Sarah handed him the corrected chart without preamble. "He's been misread for the past hour," she said. "His SATs are 89 on 2 liters. I think he's got early aspiration on top of the ulcer. He needs a chest film and probably respiratory." Reeves looked at the chart. He looked at the patient. His expression shifted. That specific shift Sarah had seen hundreds of times, the moment a doctor realizes the nurse got there first and isn't wrong. "Good catch," he said quietly. "Thank you," she said, and moved to base 6. This was the shape of Sarah Novak's nights, a relentless current of catch and correct and compensate, of filling the gaps that the hierarchy above her was too proud or too busy or too simply careless to see. She had been doing it for 2 years at Northgate General, and for 3 years before that at a small clinic in rural Montana, and before that she had done it in conditions that made the Northgate ED look like a resort spa. But she didn't talk about before. Before was a different person, more or less, or the same person in a different coat, which amounted to the same thing. At 12:45, the night changed. It didn't announce itself. It rarely did. One moment Sarah was charting in the nurse's station while Kira complained about the vending machine, and the next the radio at the security desk crackled with something that made the guard's face go carefully neutral. The face people make when they're receiving information that they don't fully understand but that they know is serious. Sarah looked up. "What was that?" she asked. The guard, a heavy-set man named Gus, who'd worked the night shift at Northgate for 11 years, glanced at her with an expression she couldn't quite read. "Mass casualty inbound, Highway 9 bypass outside the Caldwell interchange. Multiple vehicles, ETA 12 minutes. The department moved the way it always moved when the call came in, controlled panic, which was the only honest way to describe it. Stahl appeared from wherever he'd been and started issuing orders in his flat, authoritative voice, designating trauma bays, calling for blood products, ordering the on-call surgical team down. It was, Sarah had to admit, the one arena in which he was genuinely competent, the theater of emergency response, where his need for control actually served a purpose. She was assigned to intake triage with Kira and a third nurse named Brennan. Their job was to assess the incoming patients, sort by severity, and route them appropriately before the senior staff took over. Standard protocol. The first 3 ambulances arrived at 12:57 a.m. A construction worker with a crush injury to his pelvis, a teenage girl with severe head trauma, and a GCS of 8. A family of 4 with mixed injuries ranging from superficial lacerations to a broken femur. Sarah processed them methodically, quickly, without fuss, flagging the teenager for immediate neurosurgical consult and routing the others based on acuity. The 4th ambulance was different. She knew it before the doors opened. The paramedics moved differently around this one, tighter, more alert, with that specific body language of people who have been told something they're not fully at liberty to repeat. The patient was a male. She could see that much, late 40s, wearing civilian clothes that were wrong in a way she couldn't immediately articulate. Wrong in the way that clothes are wrong when they're not the clothes the person was actually supposed to be wearing. Too generic, too clean in the wrong places, too intentionally unremarkable. She'd seen that before. She'd worn that before. Gunshot wound, upper thorax and left shoulder, the lead paramedic said, reading from his tablet as they transferred the gurney. 2 entry wounds, 1 confirmed through and through on the shoulder, 1 lodged. Estimated position intercostal right side. BP's been dropping since we picked him up, currently 74/40. He was conscious on scene, kept asking for, the paramedic paused, checked his tablet, frowned, kept saying the word Specter. We didn't know if that was a person or a place or... Sarah was already at the gurney. She looked at the patient. His face was slack with shock-level blood loss, but his eyes, when she lifted one eyelid briefly, tracked correctly. He was in there. He was holding on through sheer will, which told her something about who he was even before she looked at the rest of him. She looked at the rest of him. The scar along his left jaw was old, surgical, or possibly shrapnel. The calluses on his right hand were positioned in a way that most people would never notice or know how to read. There was a very faint discoloration on his left wrist where something had been recently removed, a bracelet or a medical alert tag, or something else entirely. Her pulse didn't change. Her breathing didn't change. But something behind her eyes went very quiet and very focused. Bay 1, she said. I need a full trauma set, 2 large bore IVs, ONEG on standby, and someone page Dr. Stahl now. Kira relayed it. The gurney moved. Sarah moved with it. Inside Bay 1, it became immediately obvious that they had a problem. The through and through on the shoulder was manageable. The lodged round in the intercostal space was not because of the bullet itself, which was where it was going to stay until a surgeon decided otherwise, but because of what the bullet had done on its way in. Sarah could see it in the man's breathing pattern, the subtle asymmetry and chest wall movement, the way his breath sounds were diminished on the right side when she pressed her stethoscope to him. Tension pneumothorax building, slowly but building. She documented it and flagged it in the chart and waited for Stahl. He arrived 90 seconds later, which was actually fast for him. What have we got? He said, not a question, reaching for the chart. 2 GSWs. Shoulder through and through is stable. The intercostal wound is causing right-sided tension. Breath sounds are significantly reduced. I've got it documented. I can read a chart, Novak. He snapped it back onto the hook without finishing it and reached for the stethoscope around his own neck. He listened. He moved the stethoscope twice, his jaw set in a way she recognized, the way it set when he was deciding whether to agree with something he'd been told by someone below him. He needs OR, Stahl said. Call surgical. Dr. Stahl, his pressure is 68 now. He won't make it to OR. He's more stable than you think. The tension is minimal. It's been building for 22 minutes since the paramedics picked him up. By the time we get consent processed and surgical prepped. Are you telling me how to practice medicine? His voice was quiet. The quiet was worse than the shouting. Sarah met his eyes. I'm telling you what I'm seeing in the patient. For 3 seconds, nobody in the room moved. Then Stahl said, set up for chest tube. We'll decompress and stabilize, then move him to OR. The tension is already set up for chest tube. That's my order. He turned away. Kira, prep the surgical pack. Kira moved. Sarah looked at the monitor. The patient's pressure was now 64/38 and falling. His oxygen saturation had dropped to 84%. His respiratory rate was climbing. She did the math in her head, the same fast, brutal math she had learned not in nursing school, but in a forward operating base in a country she was not allowed to name in casual conversation, beside a medic named Hargrove, who had died 3 weeks later from a wound he'd taken while pulling a pilot out of wreckage. The math said they had maybe 90 seconds before this man's heart stopped. Chest tube setup would take 4 minutes minimum. Dr. Stahl, she said. He didn't turn around. Doctor. I heard you the first time, Novak. The monitor alarm spiked. The patient's eyes opened. He looked directly at Sarah, not at Stahl, not at the ceiling, not at the monitor, directly at her. And he said, in a voice that was barely above a breath but was absolutely, completely clear. Specter. Something in Sarah's chest went very still. She reached for the needle, the one that was already in her hand that she had quietly pulled from the drawer 12 seconds ago without announcing it, without making a show of it, because some part of her had already known. a 14-gauge angiocath. Long enough. She found the second intercostal space, mid-clavicular line, right side, a landmark she could hit blindfolded, had hit blindfolded, once, in the dark, in a vehicle moving at 60 kilometers an hour. And she placed the needle. The hiss of released pressure was immediate and unmistakable. The monitor alarm stopped. The oxygen saturation began climbing within seconds. 86, 89, 92. The patient's eyes closed. His breathing, previously shallow and desperate, deepened. Stahl turned around. The room was silent in the specific way that rooms go silent when something has happened that nobody was expecting and nobody is quite ready to process. Stahl looked at the needle. He looked at the patient. He looked at Sarah. "You performed a procedure without my authorization." His voice was controlled, but something underneath it had shifted. His heart was going to stop in 60 seconds. "That is not your call to make." "No," she agreed, "but I made it anyway." Another silence, longer this time. Kira was standing very still near the supply cart. The paramedic who had stayed to complete his handoff paperwork was looking at the floor. Stahl took 2 steps toward her. "You are a nurse, Novak. Not a physician, not a surgeon, not a trauma specialist. A floor nurse with 2 years of ER rotation and a history of overstepping on every shift. You do not make unilateral decisions in my department. Do you understand me?" "Yes," Sarah said. "Good, because I'm documenting this. And when the morning supervisor arrives, we're going to have a conversation about your continued employment here." He left. Sarah turned back to the patient, checked the needle placement, began preparing for the chest tube that would now, finally, be placed properly. Her hands were completely steady. They always were. That was the part people found unnerving, she knew. Not the competence, but the steadiness. The fact that none of it seemed to touch her. It did touch her. It just touched her somewhere private, somewhere she'd learned to keep sealed. The patient was stabilized and transferred to surgical ICU by 2:30 a.m. Sarah returned to the floor, picked up her remaining patients, and worked the rest of her shift without incident. At some point around 4 a.m., Kira appeared beside her at the medication cart and said quietly, "That was incredible. What you did in there." "It was a needle decompression," Sarah said. "It's in every ATLS manual. Stahl has never seen a nurse do it that fast." "Stahl hasn't seen a lot of things." Kira studied her for a moment. "Where did you learn that?" Sarah sealed the medication drawer, picked up her chart. "Trade school," she said, and walked away before Kira could decide whether she was joking. She wasn't joking, it just wasn't the kind of trade school Kira would ever be enrolled in. The next 3 hours passed in the ordinary rhythm of early morning emergency care. Post-midnight falls, chest pain rule-outs, a 70-year-old woman with a UTI that had been misread as a psych presentation, until Sarah looked at the labs and politely corrected the triage note. Standard. She clocked out at 7 and walked to the bus stop and stood in the cold and tried not to think about the word the patient had said. Specter. She had not heard that word in 4 years. 4 years, 2 months, and an indeterminate number of days that she had stopped counting because counting made it harder to pretend it was over. Specter was not a person. It was not a place, and it was the operational call sign for a joint intelligence unit that no longer officially existed, that had been formally dissolved and expunged from the record in a classified decommission ceremony attended by 11 people, 9 of whom she had trusted with her life at various points. The man in Bay 1 had known that word, which meant the man in Bay 1 was not a random victim of a highway shooting. Sarah got on the bus. She sat in the back. She kept her face very calm and looked out the window at the gray Caldwell City morning and thought carefully and methodically about what came next. She was still thinking about it when her phone buzzed. Unknown number, text message, 3 words. They found him. She stared at the message for a long moment. Then she deleted it, turned her phone face down on her thigh, and closed her eyes for the rest of the ride home. But she didn't sleep. Her apartment was on the 3rd floor of a building on Garrett Street. Not much, 2 rooms and a narrow kitchen, but it had a deadbolt she had installed herself and a secondary lock on the fire escape window that wasn't listed in the building specs and that her landlord didn't know about. She had lived there for 14 months. Before that, 8 months in Billings. Before that, a year in Portland. Before that, Before that was classified. She showered, changed into civilian clothes, made coffee she didn't drink, and sat at the kitchen table with a yellow legal pad she'd had for 3 years without writing a single word on it. She picked up a pen. She put it down. The text message meant someone in the old network knew the patient was in Caldwell City. They found him. The "they" was ambiguous, which was the point. It could mean friendlies. It could mean the opposite. She had 2 options. She could do nothing, stay removed, trust that the situation would resolve itself without pulling her back in. This was the smart option. This was the safe option. This was the option she had been choosing over and over for 4 years. Or she could go back to the hospital. She sat with both options for 11 minutes. Then she picked up her coat. She was back on the floor by 9:30, which raised eyebrows because her shift didn't start until 11, and Sarah Novak didn't come in early. Not ever. She signed in at the nursing station and walked past 3 colleagues without explaining herself and went directly to the surgical ICU. The patient from Bay 1 was in room 4. His name on the chart was listed as John Merritt, which was almost certainly not his name. He was sedated but stable, pressure holding, respiratory function recovered. The chest tube had been placed in OR and was draining appropriately. He would live. Sarah stood at the foot of his bed and looked at him for a long moment. Then she looked at the door. Then she looked at the window. The window faced the hospital's east parking structure, a gray, multi-level concrete building that Sarah had crossed a dozen times without thinking about it. She thought about it now. She thought about sight lines and elevation and the specific angle from the 3rd level of that structure to the SICU window. She thought about it the way she used to think about it before she'd decided to stop thinking about it. She was still at the window when the door opened behind her. She didn't flinch. She turned slowly, deliberately, the way you turn when you already knew someone was there. The man in the doorway was not a doctor. He was wearing a visitor's badge that said family, but he was not family. His posture was wrong for family, too straight, too measured, with a stillness in his hands that meant he was carrying and had been for long enough that it was completely natural to him. He looked at Sarah. Sarah looked at him. "Ms. Novak," he said. She had never told this man her name. She had never seen this man before. He reached into his jacket pocket, slowly, deliberately, with his other hand visible, and produced a credentials case that he opened and held at arm's length. The ID inside was not FBI. It was not DEA. It was not any of the 3-letter agencies that appeared in movies. The embossed seal on the left side of the ID was one that Sarah recognized from a briefing she had attended in a windowless room in a building that no longer had that room. "My name is Garrett Lowe," the man said. "I think you already know why I'm here." Sarah looked at the credentials. She looked at the patient. She looked at Lowe. "How long has this hospital been a target?" she asked. Lowe put the credentials away. His expression shifted. Not relief exactly, but the particular loosening that happens when you've been bracing for a harder conversation. "Since approximately 6 this morning," he said, "when whoever shot that man realized he survived." Sarah nodded slowly. Outside, in the parking structure she'd been watching, a black SUV that had been sitting on the 3rd level for the past 20 minutes, quietly began to move. Sarah watched the SUV complete a slow half-loop on the 3rd level and disappear behind the concrete pillar at the north end of the structure, and she felt the old arithmetic start running in the back of her head. Distance, angle, dwell time, the particular patience of people who are waiting for something specific rather than watching generally. "How many do you have on site?" she asked. Lowe shifted his weight slightly. 2. 1 on the entrance, 1 mobile. "That's not enough." "I'm aware." "Then why?" "Because we didn't know he was here until 4 hours ago." There was an edge in it, not defensiveness exactly, more the edge of someone who has been running on no sleep and bad information and is tired of explaining himself. "We're pulling additional assets, but the nearest team is 3 hours out. I need to know if this facility can be secured internally for that window." Sarah turned away from the window. "This is a hospital. It can't be secured the way you're thinking. There are 11 entrances I can count from memory. And that doesn't include the utility corridors and the loading bay on the south side that the facility's staff prop open from 8 to 4 because the keycard reader has been broken for 6 weeks. Lowe stared at her. I filed a maintenance request, she said. Twice. He ran one hand over his jaw. It was a tired gesture, and it made him look younger than she'd first estimated. Mid-40s probably, not 50. Is there a way to consolidate access? Move the patient to a more defensible location within the building. The SICU has 2 entry points and a nurse's station with direct sightlines to both. If we move him off this floor and into the ICU proper, we lose that. He stays here. She looked back at the patient. What is he? I need to know what I'm actually protecting. He's a witness. Former contractor, worked alongside a private military group called Ashford Collective for 6 years. He came in from the cold 3 weeks ago with documentation that puts Ashford at the center of 4 separate federal investigations: procurement fraud, unauthorized weapons transfers, and 2 assassinations that were officially ruled accidents. Lowe paused. The people who shot him last night aren't amateurs. The highway attack was coordinated across 3 vehicles. They had medical scanners in the intercept. They knew he'd be transported to the nearest level 2 trauma center, and they've had someone inside this hospital for at least... Inside, Sarah said flatly. Lowe's pause was exactly 1 second too long. You think there's already someone inside this building, she said. We think it's possible. We haven't confirmed who has access to this room on a scheduled basis. We're running the staff list now, but it takes time. How much time? 2 hours minimum. Sarah looked at the door. She looked at the window. She looked at the patient lying in the bed with his chest rising and falling in the careful, medicated rhythm of someone whose body had survived something it shouldn't have. I'll need a radio, she said. You're not authorized. If you want this man alive for the next 3 hours, I need a radio and I need your operative on the entrance to know my face. She kept her voice level. I'm not asking to run your operation. I'm telling you what the building requires. Lowe studied her for a long moment. Garrett Lowe, he said again, as if reintroducing himself. This time it sounded less like an opening and more like a concession. Sarah Novak, she said. And no, that's not my real name either. Now give me the radio. She tucked the earpiece into her left ear and adjusted it under her hair before she left the SICU, which took 40 seconds and required standing in front of the small mirror above the room's hand-washing station and doing something she hadn't done in 4 years, looking at herself with professional rather than personal eyes. Assessing. She didn't love what she saw, not because she was vain, but because the assessment was honest. She was tired. She'd been awake for 26 hours and running on coffee and adrenaline, and she looked it. The kind of tired that sits behind the eyes and gives everything a slight lag. The quarter-second delay in perception that, in certain situations, was exactly the quarter-second that mattered. She filed it, noted it, adjusted. Then she went back to work. The SICU nursing staff consisted of 4 people on the current shift. Renata Park, who was 20 years in and had the economy of movement that comes from knowing every inch of a floor. 2 younger nurses whose names Sarah had to check on the board, and a charge nurse named Donald Fitch, who wore compression socks and went to the break room every 90 minutes with the regularity of a clock. Sarah had worked with Renata twice during crossover shifts. She was competent, quiet, not the type to ask unnecessary questions. Renata, Sarah said at the station desk. Renata looked up from her chart. You're not on until 11. I know, I need a favor. Sarah kept her voice low and even, the way she used to brief civilians before a situation developed. Calm, not alarming, but clear. Room 4, the Merritt patient. I need to know who has had physical access to his room since he came up from surgery. Renata's eyes moved to the room, then back to Sarah. Why? I'm working with a federal contact. It's probably nothing. Probably. Renata was quiet for a moment. The OR team transferred him at 4:15. Surgical resident came by at 5 for a check. I did vitals at 6 and 8. A pause. Housekeeping came through at 6:40. I watched them, but I didn't stay the whole time. Who was it? Regular rotation. Leon usually does this floor, but he called out, so it was a float. I don't know her name. I'd have to check the facilities log. Can you check it now? Renata looked at her with the careful expression of someone who has been in hospitals long enough to know when something ordinary has become something else. Sarah, what is going on? I'll tell you everything I can as soon as I can. Right now I need the log. Renata pulled it up on her terminal without another word. Her hands were steady. Sarah noted that and was grateful for it. Float from the facilities pool. Badge scans in as Donna Wick. She's on the evening pool list, not the overnight rotation. Renata paused. She shouldn't have been here at 6:40 in the morning. Sarah's hand found the earpiece. Loe, she said quietly, turning half away from the station. I need a badge check on a facilities staff member named Donna Wick. She badged into the SICU at 0640 this morning on a float assignment that doesn't match her scheduled rotation. A brief silence. Then Lo's voice in her ear, low and tight. Running it. She waited. Renata was watching her with the focused stillness of someone who had decided to trust rather than question, which was a decision Sarah didn't take lightly. 30 seconds. 40. The name Donna Wick matches a legitimate facilities employee, 12-year tenure, no flags. Another pause. But her badge was also used to scan into the employee parking structure at 6:22 this morning. Sarah said nothing. That's 18 minutes before the SICU scan, Lo said. And the parking structure and the SICU are on opposite sides of the building. You can't be in both. No, Sarah said. You can't. She looked at Renata. I need you to keep this floor exactly as it is. Don't send anyone into room 4. If anyone shows up with a facilities or maintenance reason, you page me directly. You don't let them in. You don't explain why. Understood, Renata said, with the simplicity of someone who has decided the situation is serious and is done asking questions. Sarah was already moving toward the elevator. The facilities management office was on the sub-basement level, which was the floor most hospital staff avoided because it smelled like standing water and old concrete, and there was no cell service below the second basement. Sarah used the stairs rather than the elevator, partly for time and partly because elevators were closed environments with one exit, which was a preference she'd developed in a period of her life she rarely described. The facilities office was at the end of a corridor lit by tubes that buzzed at a frequency just high enough to be irritating. The door was partially open. Sarah pushed it and found a small cluttered room with 2 desks, a wall of badge readers and access logs, and a middle-aged man in a gray polo shirt who looked up with the startled expression of someone who was not used to people appearing without warning in his space. I need the badge logs for the SICU wing from midnight to 7 a.m., Sarah said. The man, his nameplate said Pete Gorski, facilities supervisor, blinked. I'm sorry, who are? She showed him the badge around her neck. Nursing staff. I'm coordinating with a security review. I'd need a supervisor request. You're going to get one in about 15 minutes. I'm asking now because 15 minutes may be relevant. She met his eyes. Someone used Donna Wick's badge to enter the SICU this morning while Donna Wick was in the parking structure. I need to know what other accesses happened in that window, and I need to know which of those rooms has maintenance access points. Service panels, utility doors, anything that opens from a corridor that's not a main patient hallway. Pete Gorski looked at her for a moment with the expression of a man having a very unexpected Tuesday. Then he turned to his terminal. Wick's badge was cloned, he said 3 minutes later. It wasn't a question. He'd pulled the access logs and was scrolling with the efficient speed of someone who understood what he was looking at. The ping timing is off. The SICU scan took 4 seconds longer than her average badge contact time. She always taps fast. This one sat. He scrolled further. There are 2 other anomalous accesses. Service Corridor C7, which runs behind the SICU rooms 2 through 6, and the medical gas utility closet at the north end of the floor. He looked up. The gas closet connects to the room ventilation manifolds. Sarah's jaw tightened. In the earpiece, low C7 corridor and the SICU north gas closet. Someone's already been inside. A beat. Then, I'm pulling my entrance operative to the SICU floor now. 2 minutes. The gas closet, Sarah said to Gorski. Can it be locked from the outside? Yes, but someone already... He checked his screen. Already unlocked it at 6:53 this morning. It's currently showing as unsecured. Can you lock it remotely? Yes. Do it. He did it. The terminal showed a small confirmation icon. 3 seconds of silence. Then the fire alarm on the SICU floor went off. Not the main building alarm. The zone-specific one that only triggers when a smoke sensor in a designated area activates. Sarah knew the sound from the drill they'd run in October. The same distinctive 3-pulse pattern that meant localized event, not full evacuation. She was already moving back toward the stairs. The gas closet. Someone in the ventilation manifold. The alarm could mean they'd tripped a sensor, or it could mean they'd triggered one deliberately, because a fire alarm in the SYCU meant one thing above everything else. Staff would begin moving patients. A moving patient was easier to intercept than one behind a locked door with federal protection. She took the stairs 2 at a time. The SICU floor was controlled chaos when she arrived, not full panic, because SICU nurses were trained for exactly this kind of event, but the focused, urgent movement of people executing a protocol under pressure. Renata was at the station, phone to her ear, eyes on the room doors. Donald Fitch had his emergency cart out. The 2 younger nurses were checking the monitoring cables on their patients. Sarah came off the stairwell and went straight to Renata. "Room 4, she said. "Untouched. I've had eyes on it since you called down." Renata's voice was flat and professional. "The alarm is from the north utility corridor, not a room sensor." "I know. Keep this position." She moved toward room 4 and stopped outside the door, back against the wall, the way she used to stop before entering any unfamiliar space. She listened. She wasn't carrying anything beyond her badge and a pen light, which was not ideal, but the hospital didn't issue the other things she was thinking about, and she'd stopped carrying them 4 years ago as a deliberate act of letting go. She was reconsidering that decision. The room was quiet. She went in. The patient, Merritt, or whatever his actual name was still sedated, still stable, monitors all reading within expected ranges. But something in the room was wrong, and it took her exactly 4 seconds to identify it because it was subtle. The kind of thing that only registers if you've spent time in rooms where subtle means everything. The chair beside his bed had been moved. Not much. 12 inches, maybe 15, repositioned so that it sat directly beneath the air vent in the east wall. The vent cover was not fully flush. It was off by about 3 millimeters on the right side. Enough to be invisible at a casual glance, enough to be obvious to anyone looking for it. She crossed to the vent. She didn't touch it. She crouched and looked. A small device, matte gray, roughly the size of a thumb drive, was adhered to the interior surface of the vent housing. She didn't need to pull it out to know what it was. She'd used the same device, or its predecessor, twice in her previous life, in circumstances that had produced outcomes she still didn't let herself think about at length. It was a relay, not a weapon, a listening device and a signal transmitter, which meant someone wasn't trying to kill the patient yet. Someone was trying to find out who was in this room and who was protecting him before they made that decision, which meant the killing decision hadn't been finalized, which meant there was still time. She straightened, moved to the door, kept her voice barely above a whisper. "Low. Room 4 has a relay device in the east wall vent. Passive, not active. It's a surveillance unit, not a weapon. Whoever placed it is still in assessment mode. They don't know yet whether the patient has talked." A pause. "Can you pull it?" "If I pull it, they know we found it. We leave it in, and we control what they hear." She was already running the logic. "Can your people loop a clean audio feed?" "Yes, but it would take 20 minutes, I know. Do it." Another pause, longer, then, "You've done this before." "I've done a lot of things before," Sarah said. "That's not the conversation we're having right now, Domdatz." The relay loop took 22 minutes, not 20, because Lowe's tech operative, a compact woman who arrived on the SYCU floor in hospital-issue scrubs and introduced herself to nobody, had to access the signal frequency manually rather than through a remote diagnostic, which added time. Sarah stood in the hallway and watched and didn't offer advice because the woman clearly didn't need it. The fire alarm had been silenced at the 8-minute mark. Facilities staff had confirmed a triggered sensor in C7. No actual fire, no smoke, just a sensor that had been deliberately activated, which confirmed that someone had been in the corridor and wanted them moving patients. The patient hadn't moved. Renata had held the floor without requiring instruction. When the relay loop was confirmed active, Sarah went to the break room and poured herself coffee. She also wasn't going to drink and sat down at the small table in the corner and allowed herself 45 seconds of doing nothing, which was the closest thing to rest she was currently going to get. Kira walked in at the end of the 45 seconds. "I heard there was a fire alarm," Kira said, going to the coffee machine. "Is everything okay?" "Sensor trigger. It's handled." "You're here early again." "I know." Kira poured her coffee, hesitated, then sat down at the opposite end of the table. She was doing that thing she sometimes did where she was building up to asking something she was fairly certain she wasn't going to get a straight answer to. Sarah recognized the pattern. She waited. "That patient last night," Kira said finally. "The GSW. Stahl put you in his incident report." "I know." "He's recommending a formal review, unauthorized procedure." "I know." "Sarah." Kira's voice shifted. Less curious now, more direct. "He's going to use it to push you out. He's done it before, with Pia and with Marcus last year. He finds one thing and he documents it until HR has no choice." Sarah looked at her coffee cup. "He might. And you're not worried about that." It wasn't a criticism. It was genuine bewilderment, the kind you feel when you've been watching someone absorb punishment and you can't understand why they're not fighting. Sarah picked up the cup. "I'm worried about the right things," she said. "Stahl isn't one of them right now." "That's not an answer." "No." She stood. "But it's all I've got." She was 2 steps from the break room door when her earpiece crackled. Lowe's voice came in tight and clipped and 2 notes higher than it had been all morning. "We have a problem. The relay they placed, our tech says it's not a standard surveillance unit. There's a secondary component we missed on first pass. It's not just transmitting audio." Sarah stopped. "It's also transmitting biometric data," Lowe said. "Respiratory rate, cardiac rhythm, blood pressure. It's been reading the patient's monitors through the wall, which means they already know his current condition." "They know he's stable enough to transport," Sarah said. "Yes." Which means the assessment phase is over." Lowe's voice dropped. "We just picked up 3 individuals on hospital facility cameras. They entered through the loading bay, the one you said was propped open." Sarah was already moving. "They're in the building, Sarah. They're moving toward the SICU now, and they're not carrying anything that looks like visitor badges." She hit the stairwell door and took the stairs at a controlled run, the kind where your feet are fast but your breathing stays level, where you're moving with urgency but not panic, because panic in a stairwell is how people make noise, and noise was the one thing she absolutely could not afford right now. The SICU was 2 floors up. She had, if Lowe's camera read was accurate, less than 90 seconds. And in the earpiece, just before she lost signal in the stairwell dead zone, she heard Lowe say one more thing. One thing that stopped her mid-step for exactly half a second before she kept going. "Sarah, one of the 3, our facial recognition just pulled a match. He's former intelligence. He's on the Ashford Collective payroll." A pause. "And he was in the same unit as you." She came out of the stairwell dead zone, and the signal returned in her earpiece just as she hit the SICU floor landing, and Lowe was already talking. Coordinates, positions, the clipped cadence of someone managing a situation that was deteriorating faster than the plan accounted for. "Third one just split off from the group. He's moving toward the service elevator on the south end. The other 2 are still on the main corridor approach, maybe 40 seconds from the SICU entrance." Sarah pressed through the stairwell door without breaking stride. The SICU hallway stretched in front of her, long, institutional, lit in that flat clinical way that made everything look equally important, which was the opposite of useful. Renata was at the nursing station. She saw Sarah's face and put down the chart in her hand. How many staff are on this floor right now? Sarah said, arriving at the desk. 6, including me. 2 in rooms with patients. Get them out of the corridor, all of them. Room 7 is empty. Everyone goes in there and does not come out until I say. She looked at Renata directly. And I mean everyone, you included. Renata didn't argue. She pushed back from the desk and moved. Donald Fitch was the last one out. He looked at Sarah with the expression of a man who was 62 years old and had enough institutional experience to know when a situation had left the category of normal hospital emergency. And he said quietly, "Should I call security?" "Security can't help with this," Sarah said. "Go." He went. She moved to the nursing station terminal and pulled up the camera feeds, Northgate General's internal CCTV, which was outdated and had a 4-second refresh lag, but it was what she had. She found the main SICU approach corridor on camera 6 and watched it. 2 figures, moving with the specific kind of deliberateness that looks casual to anyone not trained to read it, but is anything but. The measured pace, the positioning relative to the wall, the way they were already clocking the room positions without appearing to look at them. They were wearing maintenance coveralls over clothes that didn't match the coveralls, which meant the coveralls were the last thing they'd put on, which meant they planned to shed them. 40 seconds. Lowe had said 40 seconds, and that had been 12 seconds ago. She checked room 4 on camera 5. Patient still in bed, monitor stable, the relay device still in the vent doing whatever the looped feed was making it do. The room looked unoccupied from a surveillance standpoint. That was good. That was the one advantage she had. She looked at the corridor. She looked at the station desk. She looked at her hands, which were empty, and made a fast inventory of what the nursing station actually contained that was useful, which was not much from a tactical standpoint, but not nothing. A crash cart with a defibrillator, several lengths of IV tubing, a pair of trauma shears in the supply drawer, a portable oxygen tank, green, roughly 15 inches tall and weighing about 8 pounds when full. She pulled the oxygen tank from its bracket. Then she moved to the far end of the station, put her back against the wall at the corner where the corridor turned toward the room block, and waited. The waiting was the thing most people got wrong. They moved too early or too late. They breathed too fast. They made decisions in the waiting that they should have made before the waiting started. Sarah had done enough of it. In positions worse than this, in rooms smaller than this, in the dark, in weather, with more at stake, that she'd reached the point where the waiting itself was almost neutral. Her heart rate was elevated but controlled. Her breathing was even. The first figure came around the corner. He was looking at the room numbers, which meant he was looking slightly up and to his right, which meant he saw her a half-second later than he would have if he'd been scanning level. She hit him with the oxygen tank on the downswing, not the head, because head strikes with a metal cylinder at full force caused outcomes she didn't need right now, but across the upper arm and shoulder, the deltoid and the lateral clavicle, with enough force to compromise the arm and drive him into the wall. He went sideways. She used his momentum, got behind him, and used the IV tubing she'd already looped in her left hand to bind his wrists with enough tension to hold for 2 to 3 minutes. He was bigger than her, probably had 60 pounds on her and 4 inches. He recovered faster than she expected and got one arm partially free before she applied pressure to the radial nerve at the wrist, a specific targeted compression that produced immediate motor loss in the hand, and he stopped struggling. "Down," she said at his ear. "Quiet. All the way down, right now." He went down. The second figure came around the corner 9 seconds later, which told her they weren't moving in coordinated pairs. There was distance between them, which was either sloppy or deliberate. She didn't have the oxygen tank anymore. She dropped it when she went to the wrist compression. What she had was position and the 7 seconds before he fully processed what he was seeing. She used 5 of them. She didn't close the distance cleanly. He was turning before she got there, and she took a hit to the left shoulder that was harder than she wanted, the kind of impact that would leave something bruised deep in the muscle and make itself known tomorrow in a way she'd have to account for. But she absorbed it and kept her weight forward and drove him into the supply cabinet at the wall's end, and the collision produced the kind of structural noise she'd been hoping to avoid. The cabinet door buckled. Something fell off the top shelf and broke. He was still upright. She switched to a different approach, went low, took his base, used the momentum of his recovery push against him. He went down harder this time, face first on the linoleum, and she pinned his right arm behind him in a lock that required very little maintenance to maintain maximum pain, which freed her left hand to reach for the trauma shears she'd pocketed. She used them to cut through his coverall pocket and pull what was inside. A syringe. Preloaded. No label. She looked at it for 1 second, then she put it on the floor, stood on it until it broke, and pressed her knee harder into his back. "Don't," she said. He stopped moving. In the earpiece, "Sarah." Lowe's voice was tight. "The third one. The one who split off. He's not on any of our cameras anymore. He went into a maintenance corridor on sublevel B and we lost him." She didn't respond out loud. "Sarah, the third operative. We cannot locate him." She looked at the two men on the floor. She looked at the room block where Merritt's room was. She looked at the ceiling above room 4, which was directly above the sublevel B maintenance corridor. "Lowe," she said, "your operative in the building. Where is she right now?" "She's in the utility room where she set up the relay loop." "Which is where?" "Second floor, east wing. That's the wrong floor. I need her on this floor, room 4, right now." She paused. "And I need to know if there are any ceiling access points in the SICU block. Maintenance hatches, duct panels, anything." She heard him relay it to someone. 3 seconds. "Pete Gorski says there are 2 crawlspace access points in the SICU room block. One in the hallway between rooms 3 and 5, and one," a pause. "One inside room 4 itself, northwest corner of the ceiling." Sarah was on her feet and moving before he finished the sentence. Eek. She hit room 4's door hard enough that it swung wide and bounced off the doorstop, and she was already looking at the northwest corner of the ceiling before the door finished its arc. The ceiling hatch was a standard maintenance panel, 18 by 24 inches, recessed into the acoustic tile. It was closed. It was also... She stepped directly below it and looked carefully, not fully flush on the left edge. The gap was barely visible. 1/4 of an inch, maybe less. Someone was on the other side of it. She looked at the patient. He was still under sedation, but lightly. His eyelids had been showing increasing movement for the last hour, which meant the drugs were wearing at the expected rate, which meant he was closer to consciousness than the chart said. His monitors were steady. The relay device in the vent was still running the looped feed. She positioned herself to the side of the hatch rather than below it. This was the part that had no good options. If she called out, she confirmed she was here and he adjusted. If she waited, he controlled the timing. If she pulled the hatch open from below, she'd be directly in his eye line. And if he was carrying anything serious, that was a very bad position. What she needed was a distraction, and what she had was a hospital room. She moved to the patient's bedside. She silenced the main monitor alarm. Not the readings, just the audible alert. And then she reached to the IV pump and changed the infusion rate by 3 milliliters per hour. It was not enough to affect the patient in any meaningful way in the next 60 seconds. But it triggered the pump's occlusion sensor, which produced a loud, repeating alert tone, a different sound from the standard monitor, higher pitched, the kind of tone that required someone to physically approach the pump to silence it. The pump alarmed. She moved back to her position beside the hatch. Above her, there was movement. Small, careful, the sound of weight redistributing in a crawl space. Someone who was trying to be quiet and mostly succeeding, but not entirely. The hatch edge shifted slightly. She grabbed the edge of the hatch from the side and pulled it down and sideways in the same motion, breaking the controlled descent he'd been planning. He came through faster than he wanted to. His footing was wrong when he landed, and she used that. 2 seconds where his orientation was genuinely compromised, where the room was new to him and the distance to the patient was further than he'd calculated from above. He was the third one, the one who had been in the same unit as her. She knew him in the instant he found his footing and looked at her. Not his name, she hadn't had that from Lowe, but his face. She knew the shape of it from a briefing photograph taken 3 years ago. Dark-haired, flat-faced, a scar that ran from the outer corner of his left eye toward the ear, faded but visible. His operational call sign had been Quarry. She'd never worked directly with him, but she knew the file. He knew her face too. That was obvious from the way his expression moved. Not surprise exactly, more the particular recalibration of someone whose operational picture has just changed. Viper, he said. It was the name she hadn't heard in 4 years, 2 months, and a number of days she'd stopped counting. Hearing it in this room, from this mouth, produced a reaction she didn't fully suppress, a cold tightening in the chest that wasn't fear and wasn't anger, but was something adjacent to both. "You're 3 people short," she said. "Your other 2 are on the floor in the hallway." He glanced at the door. Brief. Professional. "How long have you been at Ashford?" she said. It was worth asking, not because she expected a straight answer, but because the way someone didn't answer told you things. "Long enough," he said. "They sent you to kill a witness." "They sent me to complete a contract." "Same thing." He shifted his weight. She tracked it. He was reading the room the same way she was. Angles, surfaces, the distance to the patient, the distance to the door. The math they were both running was the same math. "You can't protect him indefinitely," Quarry said. "You know that. We have assets you don't know about. This was one approach. It's not the only one." "I know," Sarah said, "but it's the one I'm dealing with right now." He moved. It was fast and it was committed, and he went for the patient rather than for her, which was the correct tactical choice and the one she'd been most prepared for. She got there first, not comfortably, not cleanly. She took an elbow across the cheekbone that produced an immediate white flash in her vision and set her back half a step. But she got there, and she put herself between him and the bed. The next 40 seconds were not elegant. She had the positional advantage, but he had reach on her, and he was using it, and twice she had to absorb impact rather than deflect it, because deflecting would have taken her sideways, and sideways was closer to the patient. She took a hit to the ribs that she felt immediately and would feel considerably more later. The specific hot-cold sensation of something protesting at the structural level. She got a grip on his right arm that she used for leverage, drove him into the wall unit beside the sink, heard something crack that she hoped was the wall unit rather than him because she needed him conscious. He went to one knee. She used the moment. Not to hit him again, she had enough leverage to end the immediate threat without additional force, but to get the trauma shears from her pocket and take the device from his left hand that he'd been holding since before he dropped through the hatch. She hadn't been certain he was carrying something until now. She'd been fairly certain. She looked at it. It was not a syringe this time. It was small, matte black with a single button and an antenna no longer than her thumbnail. A transmitter. The type used to trigger secondary devices remotely. She looked at the vent. She looked at the relay device in the vent. "The relay isn't just a surveillance unit," she said. He didn't answer. "Low." Her voice was completely flat. "The relay in the vent. It's not just the transmitter and the biometric reader. There's a third component. Pull your tech off the loop and get her up here right now." Low's voice came back clipped and urgent. "Say again." "There's a third component in the relay. I have the trigger in my hand. Get your tech to room 4 immediately and tell her to assume it's active." She looked at Quarry, who was still on one knee with his hand pressed to his side. "How much time?" she said. He said nothing. "Quarry." She put his operational name in her voice the way you put weight on a nail. "Not hard, just enough. How much time until it triggers automatically if you don't reset it?" He looked at the floor. His jaw moved. 12 minutes, he said. She looked at her watch. She looked at the patient. She looked at the vent. "Loe," she said. "I need your tech here in under 4 minutes, and I need a bomb disposal line in under 8, and I need you to tell me right now whether Northgate General has an evacuation protocol for the SICU that doesn't require moving critical patients through a corridor where I currently have 2 subdued hostiles on the floor." A pause. Longer than she wanted. "It doesn't," Lowe said. "Then we're improvising," Sarah said, and went to the vent. The relay was mounted with industrial adhesive to the inner housing of the vent cover, which she'd known from when she'd first looked at it 2 hours ago. What she hadn't known, what none of them had known, was that the adhesive itself was part of the design. The third component was bonded to the adhesive substrate, a small flat disc, gray-white, the diameter of a quarter, flush against the metal. It had the specific texture of a thermally activated compound, which meant it was stable at room temperature but would react to heat. either external heat from a trigger signal or, if the device wasn't reset, a timed internal heating element. 12 minutes. Now 11. Sarah Novak, RN, of Northgate General Hospital's emergency department, crouched in front of a ventilation unit with a subdued operative on the floor behind her and a sedated federal witness in the bed and an earpiece full of controlled panic, and thought about the problem the way she'd been taught to think about problems in a context that had nothing to do with hospitals. She didn't touch it. That was the first rule. You didn't touch something you hadn't fully assessed, even when the clock was running, especially when the clock was running. Because the thing about improvised device design was that the trigger you expected was rarely the only trigger. She looked at the vent housing. Standard ceiling return type, aluminum frame, 4 screws at the corners, mesh screen. The device was on the inner face of the frame plate, not the mesh, which meant the frame plate could theoretically be removed without contacting the device. If the screws came out clean, if the plate didn't bind, if the adhesive hadn't been applied to the frame edge as well. 3 ifs. She looked at the trauma shears in her hand. Not ideal for screws. She looked around the room. The wall unit she'd driven Quarry into had partially opened, and inward were the standard drawers of clinical supply. She pulled them open one by one. Bottom drawer, a small Phillips head screwdriver, the kind used for adjusting IV pump panels. It had been there for at least a year based on the dust around the handle. Someone had left it there and forgotten it, which was exactly the kind of minor institutional entropy that she had spent 2 years cataloging and everyone else had spent 2 years ignoring. 10 minutes. She had the first screw out in 40 seconds. The second in 30. The third required 2 attempts because the housing had a slight warp at the lower left corner that made the screw bind on the first pass. She backed it out, repositioned, drove it again, and it came free. The 4th screw was stripped. She looked at it, looked at the screwdriver, looked at the clock she was running in her head. She reversed the screwdriver and used the handle as a lever against the frame, applying lateral force rather than rotational, easing the plate off the housing by millimeters, feeling for resistance that would indicate a secondary adhesive contact. The plate came free on a 45-degree angle, the stripped screw pulling through the soft aluminum of the housing as it came. The device stayed with the plate, adhered to the inner face, stable. She held the plate completely still and did not breathe for 3 seconds. Still stable. She set it on the floor, face up, device visible, and sat back on her heels and allowed herself exactly 1 second of something that was not quite relief, because the problem wasn't solved yet, but was at least the recognition that the immediate worst outcome had been avoided. The door opened. Lowe's tech operative came in carrying a case she'd had in the utility room and clearly moved fast to get here. She was breathing harder than her controlled expression wanted to admit. She looked at the plate on the floor, looked at Sarah, looked at Quarry on the floor by the wall. 8 minutes, Sarah said. The tech set the case down. I need you to not touch it again. Done, Sarah said, and stood up and moved to the other side of the room and did not watch because watching someone else work a problem you've passed to them is the fastest way to make them second-guess themselves. Instead, she looked at Quarry. He was sitting with his back against the wall and his right arm held close to his body, and his breathing was shallow in a way that wasn't just exertion. She'd driven him into the wall unit at a specific angle and she was fairly certain she'd cracked at least 1 rib, possibly 2. Not debilitating, but painful. His color was okay, his breathing was labored but bilateral, which ruled out a pneumothorax. He was going to be uncomfortable for several weeks and there was nothing about that she felt particularly bad about. Ashford is going to burn, she said. He looked at her. His expression was hard to read. Not defiant exactly, not resigned, somewhere between. You know that, she said. You know what that man in the bed is carrying. You know what Ashford has been doing. You were in the same community as him, same as me. You know what it meant when those 4 investigations got buried the first time, and what it means that someone's finally bringing them back up. I know what it means for the people it touches, he said. It means exposure, it means prosecution, it means accountability, she said. For the people who used us and then erased us when it was convenient. She looked at him. You were erased too, the same way I was, the same way he was. She gestured toward the bed. And you're still working for them. He didn't answer, but something in his face shifted. A very small thing, the kind that a person who wasn't paying close attention would miss entirely. She filed it, said nothing more. Behind her, the tech said quietly, "Clear, device is neutralized." The timer was at 6 minutes, 14 seconds. Sarah let out a breath through her nose. "Good," she said. Then her radio, not the earpiece, but the actual radio Lowe had given her, clipped to her waistband, crackled with something that made the tech look up and made Sarah's hand move to it before she'd consciously decided to. It was Lowe's voice, and it was not the controlled, managed tone he'd been using for the last 2 hours. It was the other tone, the one underneath, the one that came out when the thing you've been preventing has already happened. "Sarah, Stahl found the 2 operatives in the SICU corridor. He called security. There are currently 4 security officers in the hallway, and the hospital administrator has been reached at home and is asking questions." A pause. "And a journalist from the Caldwell City Tribune, who was in the ER for an unrelated story, heard the fire alarm and is currently on the 2nd floor asking staff why there are federal personnel in the building." Sarah closed her eyes for 1 second. "Additionally," Lowe said, and his voice went quieter, "the witness is waking up. He's coming out of sedation faster than expected. He's asking for someone by name." Sarah opened her eyes. "He's not asking for me," Lowe said. "He's asking for Viper." She looked at the patient in the bed. His eyelids were moving. His right hand had closed around the bed rail with the grip of someone fighting their way back to consciousness from somewhere deep and dark. And then Renata's voice came through the general floor intercom, calm, professional, exactly the tone she always used, which made what she said significantly more alarming than if she'd sounded panicked. "All SICU staff, this is a notification. Dr. Stahl is requesting access to patient room 4 with security escort. He is currently at the SICU entrance and has administrator authorization." Sarah looked at the door. Stahl was coming through it in under 2 minutes with a security team and an administrator's approval, into a room that contained a neutralized explosive device on the floor, a subdued hostile operative against the wall with suspected broken ribs, a federal witness fighting his way out of sedation, and a nurse who had been officially reported for unauthorized medical procedures the night before. And somewhere in this building, there were Ashford Collective assets they still hadn't located. And the journalist was on the 2nd floor. And the witness was waking up. And he was asking for a name that Sarah Novak did not officially have. She had 90 seconds, maybe less. Sarah looked at the tech. "Take the device plate and get out of this room. Use the stairwell, not the elevator. Go to sublevel B and wait for Lowe's call." She looked at Quarry. "Can you walk?" He tested his weight, his jaw tightened. "Yes." "Then you're going to stand up slowly, and you're going to sit in that chair by the window, and you're going to put both hands on the armrests where anyone coming through that door can see them. You're not a detainee right now. You're a man with broken ribs who is being evaluated." He looked at her. "I'm not protecting you," she said. "I'm controlling what Stahl sees when he walks in. There's a difference." Quarry moved to the chair. The tech was already gone with the neutralized device. Sarah crossed to the patient's bedside. His eyes were open, not focused yet, the particular unfocused quality of someone who is conscious but not yet oriented, pupils equal and reactive, which she checked automatically with her pen light because some habits didn't require a decision. His lips moved. "Viper," he said, barely audible. "I'm here," she said. "Don't talk yet. You've got a chest tube and 2 IV lines, and you've been under for 6 hours. Your body needs another minute to catch up with your brain." His hand moved on the bed rail. She let him grip it. "They're in the building," he said. "Not anymore. It's handled." She kept her voice level and low. "What's your name? Your real one?" A pause. His eyes found her face and steadied. "Deckard," he said. "Thomas Deckard." "Thomas, I'm going to need you to be a patient for the next 10 minutes. Just a patient. Can you do that?" His mouth moved in something that might have been a smile under different circumstances. "Not great at it." "Nobody is," she said, and heard the SICU entrance doors open at the end of the hallway. Stahl came through the door with 2 security officers and the hospital administrator, whose name was Patricia Ewan, and who was a compact, efficient woman in her 60s that Sarah had spoken to exactly once in 2 years at a mandatory department orientation. Ewan looked like someone who had been woken up at an early hour and had decided to be angry about it in a controlled administrative way. Stahl looked like someone who had found what he'd been looking for. He stopped when he saw the room. He took in Quarry in the chair, Sarah at the bedside, the patient with his eyes partially open. He took in the scratched-up wall unit and the open ceiling hatch and the ventilation cover that was no longer covering the vent. His expression moved through several phases. Sarah watched it. "Novak," he said, "what in the hell has happened to this room?" "There was a security situation involving this patient," she said. "It's been contained." "A security?" He looked at Quarry. "Who is this man?" "He's being evaluated for a potential rib fracture. He was involved in the incident in the corridor." "The two men in the corridor are in police custody. Security already—" "This is a third individual. He came through the ceiling access." She pointed upward. Stahl looked at the open hatch. His jaw moved. "He's been cooperative, and he requires medical evaluation before he's transferred to federal custody." "Federal custody?" Ewan stepped forward. Her voice was precise and not friendly. "Ms. Novak, I have been called at 6 in the morning to be informed that there are federal personnel operating in this hospital without administrative notification, that there has been some kind of incident on the SICU floor, and that my chief of emergency medicine has filed a report indicating that a member of nursing staff has been performing unauthorized medical procedures. Can you explain to me in plain language what is going on in my hospital?" Sarah looked at her. "The patient in this bed is a federal witness in an active protection operation. He was targeted last night on Highway 9 and transferred here. The people who targeted him sent a 3-person team into this building through the south loading bay this morning to complete the attack. I became aware of the threat and worked with the federal agent coordinating the protection to neutralize it." A pause. "The two individuals in the corridor are subdued. This man is subdued. The device they placed in this room has been rendered safe and removed." Silence. Ewan stared at her. Stahl said, "Device?" "An improvised thermally activated compound. It was placed inside the SICU ventilation system during an unauthorized access at 0640 this morning using a cloned facilities badge." Another silence. Longer. Stahl's expression had done something Sarah had not seen it do before. It had gone uncertain. Not angry, not dismissive, just genuinely uncertain, which on his face looked almost like a different person entirely. "You neutralized it," Ewan said. Not a question. An attempt to verify that she'd heard correctly. "I removed the device from the vent housing and secured it. The federal technical operative confirmed it's safe before she transported it." Ewan looked at the open vent. She looked at the scratched-up wall unit. She looked at Thomas Deckard in the bed, who had closed his eyes again but whose grip on the bed rail had not loosened. "Patricia," Stahl's voice came back first. "This woman has been operating entirely outside her scope. Unauthorized procedures, unauthorized involvement in a federal operation. She had no clearance to... She had operational coordination authorization from the agent in charge," said Lowe from the doorway. Everyone looked. Lowe was standing just inside the room with his credentials case open. Behind him in the hallway, Sarah could see Renata, still at her station, watching through the glass with her arms folded. Lowe addressed Ewan directly, which was the right call. "I'm the coordinating federal officer for this protection operation. Ms. Novak acted under my direction from approximately 7:30 this morning. Her actions, including the medical procedure last night that Dr. Stahl has documented, were consistent with the emergency circumstances and with her training." He paused. "All of which I am fully prepared to explain in detail to whoever needs to hear it." Stahl turned to look at Lowe with the expression of someone whose argument has just had its foundation removed, and who hasn't fully accepted that yet. "Her training as a floor nurse does not qualify her to—" "Her training," Lowe said, "predates her nursing career by approximately 8 years." The room went quiet again. Stahl looked at Sarah. Sarah looked at him with the same expression she had used on every shift for 2 years. Neutral, waiting, giving nothing away. Boss. They cleared the room within 15 minutes. Quarry was transferred to federal custody in the hallway with 2 officers from a federal field office in Caldwell City who had arrived while Stahl was still processing what Lowe had said. Deckard's medical team, his actual medical team, the surgeon who had placed the chest tube, the intensivist who'd managed his overnight, were notified that the patient was awake and came to assess him. Sarah stepped out of room 4 and stood in the corridor and breathed. Renata appeared beside her. She didn't say anything for a moment. She just stood there, which was exactly the right thing to do. "Your cheek," Renata said finally. Sarah touched it. The spot where Quarry's elbow had connected was swelling, not dramatically, but enough to be visible. It would be purple by afternoon. "I've got a cold pack at the station," Renata said. "In a minute," Sarah said. Stahl was at the end of the corridor with Yuen and Lo, and the conversation happening between the three of them had the specific visual quality of a conversation where one person is defending a position they've just realized is indefensible. Stahl's posture had changed. The careful authority in it was gone. Not collapsed, not defeated, but redistributed somehow, like weight shifting in a structure that's been undermined at the base. Sarah watched it and felt something she didn't have a clean name for. Not satisfaction exactly, not triumph. Something smaller and more complicated. The feeling of a thing that has been held in tension for a long time finally, carefully, being set down. Lo broke away from Yuen and Stahl and walked back towards Sarah. He looked tired in the way that meant functional, the specific exhaustion of someone who has finished the acute phase of a crisis and is now facing the administrative one. "Yuen wants a full briefing," he said. "Today, her office, as soon as Deckard is stable enough to have his security confirmed." He paused. "She's suspending the incident report Stahl filed until after the briefing." "Suspending," Sarah said. "Her word. She's not withdrawing it yet. She wants to hear the full picture first." "That's fair," Sarah said. Lo looked at her with an expression that she read as something between assessment and genuine curiosity. "Most people in your position would have pushed harder for a faster resolution." "I know," she said. "But Yuen is being careful, and careful is how this stays clean. If she pulls the report too fast, it looks reactive. She needs to understand the full context before she acts on it. That's the right call." "You've thought about it." "I think about everything," she said. "That's why I'm still standing here." He almost smiled. "What do you need right now?" She considered. "I need to talk to Deckard when he's medically cleared to have a conversation, and I need to know what happens to Quarry. Federal holding until we determine his cooperation value. He may flip. He's already said enough in transport to indicate he's weighing it." "He will," Sarah said. "He's not a true believer. He was a contractor who made bad choices and then got too deep to see a way out." She looked down the corridor. "Show him a way out, and he'll take it." "How do you know?" She thought about his face in the room when she'd said the thing about being erased, the small shift she'd filed. "Because I almost made the same choice," she said, "and I know what changed my mind." She didn't explain further. Lo didn't ask. Get cut. Deckard was medically cleared for a brief, monitored conversation at 11:40 a.m. Sarah came back in to find him semi-upright, the surgical team having adjusted his position, the chest tube still in place, but the drainage already slowing to the expected rate for 48 hours post-insertion. His color was better. His eyes, when she sat in the chair that had been returned to its correct position, were fully focused. "How bad is the room?" he said. She glanced at the repaired vent cover, the wall unit that maintenance had partially resecured with adhesive and a prayer, the hatch in the ceiling that was now locked from below with a bolt someone had found in the facility's storage room. "Hospital rooms have looked worse," she said. "Did you have any help?" "Some." He studied her. "Lo says you had it before he got his people in position." "Lo's people had other things to manage." "Sarah." He said the name she'd given, the name on the badge, with the careful precision of someone who knows it's not the only name. "I know who you are. Not from Specter. I've known who you were since the decommission review. I read the file before they sealed it." She said nothing. "You didn't leave because you were burned out," he said. "You left because they asked you to do something you wouldn't do." The fluorescent light above the bed buzzed once, briefly. Outside the room, someone was moving a supply cart. "What did you bring out of Ashford?" she said. "What's actually in the documentation?" He looked at her steadily. "Procurement records, communication logs." Operational orders under false authorization signatures. He paused. 2 names attached to orders for the hits that were ruled accidents. One is a sitting federal contractor. One is a current deputy director of a federal oversight body. The same body that authorized the decommission of Specter, she said. Yes. Sarah sat with that for a moment. The reason Specter was erased, Deckard said, wasn't resource reallocation. It was because Specter was getting close to Ashford's network, and Ashford had purchase on the authorization chain. They dissolved our unit to protect themselves, and buried the personnel files so nobody could follow the thread. His grip on the bed rail tightened. 11 people in that room. 9 of them just disappeared into civilian cover. Where are the other 2? Sarah didn't answer because the answer was that she didn't know. And not knowing was something she lived with in the particular sealed-off way of someone who has decided not to open certain drawers. I need the documentation to survive transfer, Deckard said. Ashford knows what I have. They've made 2 attempts. There will be a 3rd. Lowe's team? Lowe's team is good, but they're not invisible. The moment I move from this building, I'm in transit, and transit is where they'll hit. He looked at her directly. I need you to coordinate the extraction. She looked at him. I know what I'm asking, he said. Do you? I'm asking you to stop hiding. He said it without weight, without drama, just as a fact. I'm asking you to be what you were, one more time, for a purpose that... That what? She said. That actually fixes something. His voice went quieter. We got erased, Sarah. All 11 of us. They took what we did and sealed it and used the secrecy to protect the people who were stealing from it. Ashford has been running contracts under false federal authorization for 9 years. 9 years. And the documentation to stop it is sitting in a secure server that I can access with my credentials if I'm alive long enough to do it. The room was very still. She looked at her hands in her lap. They were, as always, completely steady. The briefing with Patricia Ewan happened at 2 in the afternoon in the administrator's office on the 4th floor, and it was one of the more unusual meetings Northgate General Hospital had hosted, which was saying something for a building that had seen most of the extremes of human experience across its 27 years of operation. Lowe presented the operation timeline. The tech operative, whose name Sarah still didn't know, presented the device analysis. Sarah sat to Lowe's left and answered questions as they came. Stahl sat across the table. He had been invited because Ewan had decided correctly that exclusion would have been a different kind of problem. It would have let him fill the gaps with his own version. This way, he heard everything. This way, there were no gaps to fill. He was very quiet throughout. Ewan asked precise, intelligent questions and took notes in a tight, angular handwriting that covered 3 pages by the time the factual portion was complete. She asked about the needle decompression from the previous night. She asked Lowe to confirm, on record, that the procedure had been medically indicated and had preserved the patient's life pending surgical intervention. Lowe confirmed it. She asked whether Sarah had acted within the scope of her operational role during the morning's events. Lowe confirmed that too. Ewan made a note. She looked at the note. She looked at Sarah. Why didn't you tell anyone who you were? Ewan said. Not accusatory, genuinely asking. Because I came here to be a nurse, Sarah said, not to be anything else. Ewan considered that. And now I'm still a nurse, Sarah said. Who happens to have a problem to finish? At the end of the table, Stahl had been holding a pen he hadn't used for the last 40 minutes. He set it down with a small, careful sound that nobody commented on. Ewan looked at him. Raymond, she said, and the use of his first name in that tone contained a full sentence that she chose not to speak aloud, because Patricia Ewan was a woman who had run a major hospital for 14 years by understanding exactly how much could be communicated without direct statement. Stahl said, I understand. Whether he did or didn't was, Sarah thought, a matter for the next few weeks to resolve. She found Kira in the break room at 3:15. Kira was sitting at the corner table where Sarah had sat that morning, holding a mug she wasn't drinking from, and she looked up when Sarah came in with an expression that was equal parts relief and bewilderment. Are you okay? Kira said. Sarah poured water from the tap. Mostly. She touched the cheekbone. The cold pack Renata had given her had reduced the swelling, but the bruise was visible now, a dark half-moon under her left eye. Everyone's talking, Kira said. The security thing, the federal people in the building. Pete from facilities told someone in radiology that there was a bomb in the SICU, and now it wasn't a bomb, Sarah said. It was an incendiary device, which is different in several technical respects and similar in the one that matters. Kira stared at her. It's handled, Sarah said. The building is safe. And Sarah, you were in that room, alone. Not entirely alone. That's not... Kira put the mug down. Who are you? I mean, I know who you are. I've worked with you for 2 years, but who are you? Sarah looked at the water in her cup. It was a fair question. It was the question Ewan had asked a different version of. It was the question Deckard had answered on her behalf by reading a sealed file. I'm Sarah Novak, she said. That's my name. The rest of it is... She stopped. Started again. I did a different job before this one, for a long time, in places I can't talk about for people who turned out not to deserve it. And then I stopped and I came here and I have spent 2 years being a nurse, and that has not been performance or hiding. It's been the real thing. She looked at Kira. Both things can be true. Kira was quiet for a moment, then, the thing in Bay 1 last night. The needle. Yes. You knew exactly what you were doing. Yes. And Stahl made a call I disagreed with. I made a different call. The patient is alive. Sarah set down her water cup. That's the part that matters. Kira looked at her for a long time. Not with the bewilderment anymore. With something closer to the expression people wear when they've been carrying an assumption for a long time and have just realized it was the wrong shape. I've been telling people for months that you were just nervous, Kira said, that you just needed more confidence. I know, Sarah said. I feel like an idiot. You weren't wrong about everything, Sarah said. I am nervous sometimes. Confidence is different from what I have. What I have is more like, she considered, like certainty in specific moments. The rest of the time, I'm as uncertain as anyone. That was true. It was also the most she'd said about herself in 2 years, and she felt the edges of it in her chest. Not uncomfortable exactly, but unfamiliar. Like moving in a room you've kept locked. Tom. At 4:30, Lo found her at the nurse's station where she'd picked up the remainder of her shift because the floor still needed to function, and functioning was something she could do. Deckard's transfer is scheduled for tomorrow morning, Lo said quietly, standing beside the station rather than at it. The way people stand when they're having a conversation they want to look casual about. 5 a.m. federal vehicle convoy, 4 agents plus driver. That's the plan he knows about, Sarah said. Lo paused. Yes. Which means it's the plan Ashford knows about too, if they have any remaining assets with access to federal operational channels. Which they may. Another pause. I've drafted a parallel extraction. Different vehicle, different timing, different route. Off book. If Ashford's network includes anyone in the federal chain of communication, the primary plan is bait. Sarah processed this. And the parallel extraction needs a coordinator they don't have any record of, someone completely outside the documented chain. He looked at her, not directly, the way people look when they're asking something and want to leave room for the answer to be no. Deckard asked for you specifically. I know, she said. He told me this morning. And she straightened a chart, returned it to the rack, looked at the SICU end of the corridor where Renata was doing her rounds with the same economy of movement she always did, where the rooms held people who were sick and hurt and needed someone to think clearly on their behalf. I have a shift until 7, she said. Lo blinked. I'll finish my shift, she said, and then I'll meet with you and Deckard and we'll plan the extraction. She looked at him. But I need something in return. What? The full Specter decommission file, unredacted, all 11 personnel records, including the 2 I don't have locations for. Lo's expression shifted. That's classified above my clearance level. I know, she said. Get it anyway. He looked at her for a moment. Okay, he said. She went back to her charts. Debts. At 6:47 p.m., 13 minutes before her shift ended, her hospital phone rang. Internal extension. Administrative office, 4th floor. She answered it. It was Patricia Ewan. The incident report Dr. Stahl filed, Ewan said without preamble. I've reviewed it in full in light of today's briefing, and I've consulted with HR and our legal team. Sarah waited. The report is being withdrawn, Ewan said. Effective immediately. I'll have documentation to you by end of business tomorrow. Thank you, Sarah said. Don't thank me. It's a correction, not a favor. A pause. I also want you to know that I've initiated a separate review of Dr. Stahl's conduct, not just this incident, but a pattern that's been documented across multiple staff complaints over the past 3 years. That review will be conducted by an external HR firm and will take whatever time it takes. Another pause. I should have started it sooner. Sarah said nothing. That's an institutional failure, Ewan said, not yours. I'm telling you because you deserve to know that what happened to you and apparently to others is being taken seriously. Her voice was precise and not warm, but it was honest in a way that Sarah respected. Do you have anything you'd like to say? Sarah thought about 2 years of lowered eyes and swallowed responses and charts corrected quietly and procedures performed under the weight of being small in a system that had decided her size. No, she said. I think that covers it. She hung up. She stood at the nurse's station for a moment. Renata was watching from the end of the corridor. When Sarah looked at her, Renata gave her a nod, the small, unshowy kind, and went back to her rounds. Iman. She changed out of her scrubs at 7:15 and was walking through the hospital's main lobby toward the exit when she stopped. The journalist from the Caldwell City Tribune had apparently been there for some time. She was a young woman, early 30s, with a press lanyard and a recorder and the specific posture of someone who has been sitting in a hospital lobby for 6 hours and has developed a theory about why that was necessary. She looked at Sarah's bruised cheek. She looked at the badge still clipped to Sarah's coat. Excuse me, she said. Are you nursing staff? Yes, Sarah said. I've been here since this morning. There was a fire alarm, there were federal agents in the building, there are 2 men in police custody who apparently were brought down on the SICU floor by... She checked her notepad. A nurse. She looked at Sarah. Were you involved in what happened here today? Sarah looked at her. She thought about what Deckard had said. They took what we did and sealed it and used the secrecy to protect the people who were stealing from it. She thought about 9 years of Ashford operating under false authorization. She thought about 4 federal investigations buried. She thought about 2 deaths ruled accidents. I work here, Sarah said carefully. Today was an unusual day. Can I ask your name? Sarah Novak. She looked at the journalist's recorder. And I think you should stay right where you are, because in about 30 hours, there is going to be a story worth telling. But if you print anything before then, you'll compromise an active federal operation and several people's safety, including the person at the center of it. The journalist looked at her. 30 hours, Sarah said. Can you wait? That depends on the story, the journalist said. The story, Sarah said, involves 9 years of federal fraud, 2 covered homicides, a private military organization with purchase on an oversight body, and a classified intelligence unit that was deliberately erased to protect the people stealing from it. She paused. And a federal witness who is alive right now because a nurse on a night shift made a call the doctor in charge told her not to make. The journalist's hand had tightened on the recorder. 30 hours, Sarah said again. I can wait, the journalist said. Sarah walked through the lobby doors and into the cold Caldwell City evening, and behind her the hospital stood in its full lit-up institutional reality. Broken things and fixed things. The ordinary and the catastrophic running on parallel tracks. People doing impossible work for insufficient recognition inside walls that absorbed everything and remembered nothing. She zipped her coat. She had a meeting in 1 hour with Lowe and a federal witness who needed to survive the night. She had 30 hours after that. And somewhere in an unredacted file that Lowe was going to acquire, whether his clearance covered it or not, there were 2 names she had been not looking for 4 years, 2 months, and a number of days she had definitely not stopped counting. She walked to the bus stop. She stood in the cold. Her hands were steady. And 3 blocks away, in the parking structure across from the hospital's east entrance, a car that had been sitting on the second level for the past 2 hours turned its lights on for the first time. Not to leave, but to signal. And Sarah, who had been watching the structure in the reflection of the bus shelter's scratched plastic panel since she'd come through the lobby doors, took note of it and did not react and kept her breathing even. Because there was a 4th operative, and she had been waiting for the 4th operative all day. She didn't move toward the parking structure. That was the first thing. Not moving, not reacting, not giving the car anything to read in the reflection panel it may or may not have been watching. She stood at the bus stop with her hands in her coat pockets and her eyes on the middle distance, and she counted. The car had turned its lights on at 7:23. Signal behavior, not departure behavior. The angle was wrong for someone preparing to pull out, and it had been sitting too long in too specific a position for it to be coincidence. Second level, north end, facing east, which meant it had a sight line to the hospital's main entrance and to the bus stop, and to approximately 40 feet of the sidewalk on either side. She had walked through the lobby doors at 7:21, 2 minutes of observation before the signal, which meant whoever was in that car had been waiting for confirmation that she'd left the building before communicating. Communicating with whom was the question. She kept her breathing even and her posture relaxed, and she thought about it with the same methodical patience she'd been applying since 6 this morning. The same patience that people had been misreading as passivity for 2 years, as softness, as the absence of something rather than the presence of a different thing entirely. She reached into her coat pocket and pressed the transmit button on the radio Lowe had given her twice. The prearranged signal for a nonverbal contact, the one that meant I see something and I'm not in immediate danger, but I need your attention. 8 seconds later, Lowe's voice in her earpiece. Go. Parking structure, second level north end, car, dark colored. Been there since at least 1500 based on my earlier observation. Lights came on 2 minutes after I exited. Signal behavior, not departure. I think it's a spotter. A pause. She heard him relay it to someone. We're pulling the structure camera, Lowe said. How long? 90 seconds. The bus arrived. She got on it. Not because she was going home. She wasn't going home. She was going to the meeting point Lowe had designated 3 hours ago, a federal staging facility on the west side of Caldwell City. But because standing at a bus stop for longer than the bus's dwell time was an anomaly that a trained spotter would notice. She rode 2 stops. She got off. She walked east on Fenwick Street with the specific unremarkable quality of someone going somewhere ordinary, and she did not check behind her directly, but she used every reflective surface the street provided. A darkened storefront, a parked car's passenger window, the glass front of a dry cleaner that was closed for the night. She was not being followed on foot. She turned north on Aldous Avenue and found the parking garage Lowe had specified, public, 4 levels, the attendance booth empty after 6, and went to the second level and got into the unmarked sedan that was sitting in space 214 with its engine running and a federal agent in the driver's seat who had the particular expression of someone who had been briefed about her and wasn't sure what he'd expected, but it hadn't been this. Novak? He said. Yes, she said, and closed the door. Lowe was at the staging facility when she arrived, a converted commercial unit in a low-profile industrial block that smelled like old coffee and new carpet adhesive, the kind of space that looked like nothing from the outside because it was designed to. He had the parking structure camera footage on a laptop. Silver Honda, Caldwell City plates, he said, turning the screen toward her. Registered to a shell company. Our people ran the company. It traces back through 3 intermediary LLCs to an entity that has documented financial relationships with Ashford Collective. He looked at her. The driver made a call on a burner at 7:24. We caught the signal but not the content. Encrypted channel. He was confirming I'd left the building, Sarah said, which means the original plan wasn't to hit the hospital again. They were watching exit patterns. They want to follow me to Deckard. That's our read, too. Which means they don't know about this facility. Not yet. But they know I'm involved in the extraction now. Quarry told them. She said it without heat. It wasn't an accusation, it was a variable. Quarry had been in custody for 10 hours, which was long enough for a communication to have gotten out through whatever channels Ashford maintained in places they shouldn't. Lowe's expression confirmed it without words. All right, she said. Then we use it. He looked at her. They're expecting me to lead them to Deckard, she said. Which means if I lead them somewhere that isn't Deckard, we control where they go. We control when. And we control who's waiting. You want to use yourself as bait. I want to use the assumption about me as bait. There's a difference. She pulled a chair from the table and sat. What do you have in terms of personnel? 8 agents, including the 2 in this building, and Federal Arrest Authority. Full. Then here's what I need. She was back on Fenwick Street at 10:15 p.m., which was deliberate, late enough that the foot traffic was thin, early enough that the businesses on the block still had their lights on and provided ambient cover. She walked north, then east, in a route that she had designed to look like someone who wasn't sure where they were going but was trying to be careful, which was the specific movement signature of someone conducting a surveillance detection route who hadn't quite finished their training. She was very good at performing the uncanny valley of almost competent. The silver Honda picked her up on the 3rd block. She clocked it in the window of a closed restaurant without breaking stride. Headlights on, hanging back at the distance that suggested practice surveillance rather than amateur following. There might have been a second vehicle she wasn't seeing, which was why Lowe had 2 agents in a parallel position 3 blocks north. She kept walking. The route took her 12 blocks, which was longer than necessary, but gave Lowe's team time to close the secondary perimeter and gave her time to confirm the surveillance pattern. By block 8, she was confident there were 2 vehicles, the Honda and a gray pickup that was doing a loose box with it, trading lead position every 3 blocks in a rotation that was professional enough to indicate training, but rigid enough to indicate that the training was older or the personnel weren't their sharpest. She turned onto Birch Street, which was the street she'd told Lowe she would turn onto, which was where the federal staging position was not, but where it looked like it could be. An industrial building with internal lights visible through frosted windows, a legitimate business that Lowe had coordinated with for exactly this purpose. She went to the door. She used the key Lowe had given her. She went inside. And then she waited, in a building that had 8 federal agents positioned in it and 0 federal witnesses, and she did not have to wait long. They came through 2 entry points simultaneously, which confirmed 2 things. They were trained, and there were more than the 2 vehicles she'd identified. The east door and the south window, 4 seconds apart, 2 through each, which was a reasonable forced entry approach for a building they hadn't surveilled long enough to fully understand. The problem with entering a building you haven't surveilled long enough was that you didn't know about the pressure sensors on the east floor or the secondary lighting grid that Lowe's people had rigged to the manual switch by the loading bay, and you didn't know that the woman you'd followed there had positioned herself in the one place in the building where the sight lines to both entry points converged. But neither entry team could see her until they were already inside and had committed to their positions. Lowe gave the signal at the 14-second mark. The lights came on. The federal agents came out of position. It was not clean. These things were never clean. One of Lowe's agents took a hit to the shoulder from the second man through the east door, a glancing impact rather than a direct one, but enough to put him on one knee and require the agent beside him to adjust coverage. One of the Ashford operatives ran for the south window he'd come through and got 6 feet before he was intercepted. There was shouting in the specific fractured overlapping way of a room where multiple things are happening at once and everyone is operating on partial information. Sarah stayed in her position until the perimeter was called clear, which took 4 minutes and 40 seconds. Then she walked out to where Lowe was standing near the east door with the 4 detained operatives zip-cuffed and seated against the wall and his phone to his ear, and she looked at the 4 of them. She didn't know 3 of them. The 4th she recognized from a different context. Not Specter, not Ashford, but a face from a federal contractor briefing she'd attended in a previous life. A face that had been on the authorized side of the table, which meant he was not a freelance hire. He was the contact. Lowe, she said quietly. Far right. He's not Ashford Field. He's the inside connection. Lowe looked, His jaw tightened. He was in a federal contractor briefing approximately 5 years ago, she said. I can't give you the exact date without the file, but the decommission records will cross-reference him. Lowe relayed it to someone on the phone. 12 minutes later, the cross-reference came back. The man against the wall, Northgate, whose name turned out to be Paul Greer, whose current listed employment was as a compliance auditor for a federal oversight subsidiary, had a documented relationship with Ashford Collective that went back 7 years, predating Specter's dissolution by 2 years, which meant he had been in position before the decommission and had almost certainly been part of the authorization chain that buried the 4 investigations Deckard had documented. Which meant he was not a peripheral figure. He was a central one. Sarah looked at him, and he looked at her. And in his expression, she could see the specific calculation of someone assessing how bad this was. And the answer he was arriving at was clearly very bad, because the calculation kept running and arriving at the same place. You're going to want a lawyer, she said. A good one. He didn't respond. She walked away. Mom. Deckard's actual extraction happened at 4:15 a.m., 90 minutes before the documented federal convoy plan was scheduled to depart, via a route that Lowe had filed with no one in the federal system and transmitted to exactly 4 people by handwritten note, which was old-fashioned and also impossible to intercept through electronic channels. Sarah was in the second vehicle. She wasn't driving and she wasn't running point. Those were Lowe's people. But she was present, which was what Deckard had asked for and what she had agreed to. And she sat in the back of the vehicle beside him for the 40-minute drive to the federal processing facility, and neither of them said much. At the 20-minute mark, he said, "The 2 names in the decommission file. You got them." Lowe pulled the file last night, she said. And? She looked at the dark road through the windshield. One of them is in Caldwell City. The other is in a city I'm going to have to travel to. Are they alive? Yes. He was quiet for a moment. What are you going to do? Make contact, she said, and find out who else needs to be found. He nodded slowly. It was the nod of someone who understands that some things don't resolve in a single event, that some corrections take time and a series of smaller corrections, that what matters is the direction rather than the speed. What about the hospital, he said. She thought about Renata at the nursing station with her arms folded, about Kira in the break room reassessing an assumption she'd been carrying for months, about Patricia Ewan writing notes in her tight, angular handwriting and making corrections she should have made sooner and being honest about that. The hospital, she said, is where I work. He looked at her. I'm going to make contact with the 2 names, she said. And then I'm going back to Northgate General. I have a shift Thursday. You're serious? Why wouldn't I be? He didn't answer right away. Outside, the Caldwell City suburbs gave way to the longer stretches of the highway, the flat dark of the pre-dawn interstate, the occasional distant lights of other cars going other places. Because you could do other things, he said finally, with what you know, with what you are. I do other things when other things need doing, she said. That's what today was. But the rest of the time, people come into emergency rooms with conditions that are being misread and IV lines that are occluded and blood pressures that someone entered wrong in the system, and those things need doing too. She looked at him. And I'm good at it. Not the other job. This one. He was quiet for the rest of the drive. When they reached the facility and the vehicle stopped and the agents came to manage the transfer, he looked at her one more time before he got out. Thank you, he said. It was plainly stated without ceremony, which was the right register for it. Don't die during processing, she said. The documentation is the whole point. He almost smiled, and she almost did too, and then he was out of the vehicle and being walked through a secured entrance, and she watched until the door closed behind him. The story broke at 11:40 a.m. the following day. Nadia Voss of the Caldwell City Tribune had waited her 30 hours, had in fact waited 31, because Sarah had called her at the 8 a.m. mark to ask for 1 more hour while the federal processing paperwork was confirmed. Voss had agreed, which Sarah filed as evidence of both professional integrity and the particular patience of a journalist who knows the story she has is worth waiting for. The initial piece ran online and moved to print by afternoon, By evening, it had been picked up by 4 national outlets. By the following morning, it was everywhere. The headline, which Sarah read on her phone at the nurses' station between patients, was measured and direct in the way that good journalism is measured and direct. Federal witness survives assassination attempt. Documents link private military firm to 9 years of fraud and 2 covered homicides. The subheadline, which Sarah had not been consulted on and which she had complicated feelings about, read, Caldwell City nurse at center of hospital standoff, identified as former special operations medic. She put her phone face down on the desk. Renata appeared beside her. It's accurate, Renata said, having apparently read over her shoulder. Most of it, Sarah said. Which parts aren't? They called it a standoff. It wasn't a standoff. A standoff implies a negotiation phase. She picked up the chart she'd been working on. It was a series of individual containment situations, which is different. Renata looked at her. That's what you're objecting to. Among other things. Your name is in a national newspaper as a former special operations medic who neutralized 3 intelligence operatives and an explosive device in a hospital. I'm aware. And you're charting Mr. Allard's post-op vitals. His drainage output was flagged in the overnight notes and nobody followed up. She made the correction in the chart. That's why I'm charting it. Renata was quiet for a moment. Then she made a sound that was not quite a laugh, but was in the neighborhood of one, and she went back to her end of the station, and the floor continued in the way the floor always continued, relentlessly, imperfectly, with the particular texture of a place where too much was always happening and too few people were doing it. Boy, the consequences arrived in pieces, the way they always do when something large and institutional starts to move. Paul Greer was charged federally within 48 hours. Conspiracy, obstruction, and 2 counts of accessory to murder, the last 2 related to the deaths that had been ruled accidents, and that Deckard's documentation directly contradicted. His lawyer filed a motion for bail that was denied. His listed employer, the Federal Oversight Subsidiary, suspended him pending investigation, and then, when the investigation progressed faster than anyone had expected, terminated his contract entirely and issued a public statement distancing themselves from his conduct, which was the institutional equivalent of someone stepping away from a fire they'd been standing in front of for years. Ashford Collective's operational licenses were suspended within 72 hours of Greer's arrest, pending review by 3 separate federal bodies. The review, Lowe told Sarah in a brief call that week, was not expected to conclude in Ashford's favor. The private military firm that had been operating under false federal authorization for 9 years, running contracts that had been approved through a chain of oversight it had spent those 9 years carefully corrupting, was going to be dismantled. Not quietly. Publicly, with the specific visibility that comes when federal investigators have complete documentation and a witness who is alive and coherent and extremely motivated to talk. Quarry, whose real name, Sarah learned, was Marcus Hale, which she filed without particular emotion, had begun cooperating with federal investigators within 24 hours of his arrest. He provided operational details that extended the investigation into 3 additional state jurisdictions. In exchange for cooperation, he was looking at a reduced charge that would still carry significant prison time, which was not justice in its cleanest form, but was a version of justice that produced additional accountability, which was the version Sarah decided to accept. The deputy director whose name had appeared in Deckard's documentation, the one who sat on the oversight body that had authorized Specter's dissolution, resigned on day 4. He did not cite the investigation in his resignation statement, but the resignation statement was issued 8 hours after federal investigators had contacted his office for a voluntary interview, and the timing was the only comment required. Sarah read about his resignation on the hospital's break room television between her morning rounds and her afternoon patients. She poured coffee. She went back to work. Dr. Raymond Stahl's situation resolved more slowly, and in a way that was more complicated than a single decisive moment, which was appropriate because that was also how it had been built. The external HR review that Patricia Ewan had initiated found a documented pattern across 19 staff complaints over 3 years. Incidents involving belittling language, procedural blame shifting, and in 3 cases, documentation practices that appeared designed to undermine staff members before termination. Stahl had not invented the tactic he'd used with Sarah. He had refined it through practice on people who had fewer resources, less confidence, or less support from those around them, and who had often left Northgate General quietly without fully understanding what had happened to them. The review recommended termination. Ewan presented him with the recommendation on a Wednesday morning. Sarah was not present for it. She heard about it from Renata, who heard about it from Donald Fitch, who had apparently been called as a witness to the review, and who had provided a 22-year institutional memory that was, Fitch's word according to Renata, exhaustive. Stahl contested the termination. The contest extended the process by 3 weeks, during which he remained on administrative leave. The contest ultimately failed. On a Thursday afternoon in the second week of December, his name was removed from the departmental directory. By Friday morning, the schedule board that had listed him as chief of emergency medicine for 6 years had been updated with an interim designation. Sarah was charting when she noticed. She looked at the board. She looked back at her chart. She felt something, looking at it. She examined the feeling honestly, the way she tried to examine things she'd rather not look at directly. It was not triumph. It was not the satisfaction of a particular score settled. It was something more structural, the feeling of a weight that you've been carrying so long you've stopped noticing it, finally, quietly, being lifted. She didn't mention it to anyone. She didn't need to. Shut. The 2 names in the decommissioned file took longer than she'd hoped. The first one, the person in Caldwell City, was a woman named Petra Sandoval, who had left the intelligence community 3 years after Specter's dissolution and was now running a small private security consultation practice out of a building on the north side of the city. Sarah found her on a Tuesday off. She brought 2 coffees because it seemed like the thing to do and because she genuinely didn't know how the conversation was going to go. It went better than she expected, which was not the same as going well. They sat in Petra's office for 2 hours and covered 8 years of separate silence in the particular halting, circular way that people cover things they've been carrying alone for a long time. There were things Petra said that Sarah didn't know, and things Sarah said that Petra had been wondering about, and moments where both of them sat without speaking, because some of it was simply too large for words to contain neatly. At the end of it, Petra said, "I thought I was the only one who got out." "You weren't," Sarah said. "I know that now." Petra looked at her coffee cup. "Where's the second name?" "Portland. I'm going next week." Petra nodded. Then, "Can I come?" Sarah looked at her. "We didn't choose to disappear separately," Petra said. "We were made to. I don't want to stay separate now just because that's how it was arranged." "No," Sarah said. "Neither do I." Cool. The federal testimony hearings began 6 weeks after Deckard's extraction. Deckard testified over 3 days in a closed session before an oversight committee, submitting the documentation and providing context for each element of it. Sarah was not in the room for that. She was not a party to the federal proceedings and didn't seek to be. But she read the committee's preliminary findings when they were released, as they eventually were, in a partially redacted public summary that was careful in its language but not careful enough to obscure what had happened. 9 years, 4 investigations buried, 11 people in a room whose careers and lives had been disrupted so that the disruption could not produce inconvenient testimony. 2 deaths that had been filed as accidents and that were now being treated as homicides by the applicable federal office. She read the summary at her kitchen table on a Saturday morning with actual hot coffee, which was still something of a novelty, and when she finished reading, she put the tablet down and sat for a while. The window above the sink faced west. The November light came through it at a low angle and sat on the kitchen floor in a thin, pale rectangle that shifted almost imperceptibly as the morning moved. She watched it for a while, which was something she almost never did. Sitting still for its own sake, without a task, without a problem to work. She had spent 4 years being small because the thing she'd come from had turned out to be built on something rotten, and the smallness had felt like the appropriate response to that, like the responsible choice, like the way you honor a mistake by not repeating it. She had come to Caldwell City and taken the bus to the east side and stood in the cold and clocked in 7 minutes late and done the work as honestly as she could do it and allowed people who had no idea what they were looking at to form whatever picture they formed. And she had not been wrong about any of it. The nursing was real. The care was real. The work of being present for people in the worst moments of their lives, of catching the reading that was off and the line that was occluded and the pattern in the data that everyone else was moving too fast to see. That was real, and it was what she was. And the thing she'd been before it was also what she was. And she had spent 4 years pretending those were incompatible, that the one required the erasure of the other. They didn't. They never had. The erasing had been something done to her, and she had cooperated with it because she'd been tired, and because she'd needed somewhere to put herself where nothing was required of her beyond what she chose to give. That was okay. She didn't think it was a failure exactly. She thought it was the thing that had been necessary, for the time it was necessary, which was different. The light on the kitchen floor moved another half-inch. She picked up her coffee. She was back on the floor on Monday with a bruise that had faded from purple to yellow, and a voicemail from Voss at the Tribune she had not yet returned, and a pair of new scrubs because the old ones had finally developed a hole in the left knee that was beyond reasonable repair. Kira was at the station when she came in. She looked at Sarah with the particular expression she'd had since the story broke, the recalibrated one, the one that wasn't uncertainty or awe exactly, but was something in between. "There's a new attending starting in January," Kira said. "They sent an announcement this morning." "I saw it," Sarah said. "She trained at Mercy General in Phoenix. Her staff reviews are—" Kira made a gesture that communicated something comprehensively positive. "Like, uniformly excellent. People seem to actually like working with her." "That would be a change, but," Sarah said. "Yeah." Kira looked at her for a moment. "Are you staying?" Sarah looked at the board, at the patient list, at the corridor that led to the trauma bays and the rooms beyond them. "Yes," she said. "Even with, after everything, you could—" "I know," Sarah said. "I'm staying." Kira nodded. She looked like she was going to say something else and then decided that what had been said was enough, which was the right call. She went back to her chart. Sarah clipped her badge to her scrubs. Sarah Novak, RN, General Medicine, Northgate General Hospital. The same badge, the same words, the same plain fact of what she was and where she was. She thought about Stahl saying, "You're just a nurse," the way he'd said it. Flat, dismissive, a ceiling installed with 2 words. And she thought about everything those 2 words had failed to contain. Not just about her, but about every person who had ever worn the same designation and held a stranger's hand in the dark and caught the number that was wrong and stayed past the end of their shift because the patient wasn't stable and there was no one else. Just a nurse. She had saved a man's life with a 14-gauge needle in a trauma bay. She had neutralized an explosive device with a Phillips head screwdriver she'd found in a supply drawer. She had walked 12 blocks in the cold to lead a surveillance team into a controlled federal intercept. She had done all of it, and then come back to the floor and corrected a drainage chart that nobody had followed up on. Not because one of those things was more important than the other, because all of them were the same impulse, expressed in whatever language the situation required. You see what needs doing, and you do it. That was the whole of it. Lowe called on a Thursday, 3 weeks after the testimony hearings ended. "The Oversight Committee issued its final report this morning," he said. "I saw the summary. The full report includes a section on Specter's dissolution. The committee found that the decommission authorization was obtained under falsified circumstances and that the unit's dissolution did not follow required protocol." A pause. "They're issuing a formal reinstatement of record for all 11 personnel. Not reinstatement to service, the unit doesn't exist anymore, but reinstatement of record. Your file will exist. Your service will be documented." Sarah stood at the window at the end of the SICU corridor, the one that faced the parking structure, and looked at the structure in the flat December light. "Your classification will be updated," Lowe said, "and there will be a formal acknowledgement from the committee for your actions during the Deckard protection." "A formal acknowledgement," she said, "in the public portion of the report, by name." She thought about what it meant to be in a file that existed, to have a record that no one had erased, to be documented as someone who had done something rather than someone who had never existed. She thought it was smaller than people might imagine. She also thought it was not nothing. "Thank you," she said. "Sarah." His voice shifted slightly, not the operational voice, the other one. "The work you did here, Greer in custody, Ashford dismantled, Deckard alive, the documentation in front of a committee. That doesn't happen without you. It doesn't happen without Deckard surviving a highway attack and 2 more attempts, she said. It doesn't happen without Renata holding the floor, or Pete Gorski pulling the badge log, or Voss waiting her 30 hours. She paused. It's not one person. No, he said, but some people are more central than they choose to appear. She didn't answer that directly. How's the shoulder? She said instead. His operative, who'd taken the hit in the Birch Street facility, the one she'd asked about twice already. Healing, he said. She's back on light duty. Good. She looked at the parking structure, empty now, or appearing to be. I'm going to Portland next week. The second name. Yes. Do you need support? I need a plane ticket and the address, she said. I have the rest. He said he'd send it. He said take care of yourself, which was something people said and which she received as it was intended, without irony, and then the call ended and she stood at the window for another moment before going back to the floor. December settled over Caldwell City the way December settled over most northern places. Slowly, then all at once, the cold arriving with its particular clarity that made the air feel more honest somehow, stripped of the softening that other seasons provided. On the last shift before she flew to Portland, Sarah did 4 IV line placements, caught a medication error in a handoff note, talked a 68-year-old man through the specific terror of a cardiac catheterization he'd been delaying for 2 years, and helped Renata restrain a supply cart that had developed a wheel alignment problem that sent it veering left every time anyone tried to push it straight. The supply cart problem was ultimately unresolved. Maintenance request, Renata said. 3rd one, Sarah said. Maybe 4th. Someday they'll fix it. Or we'll keep compensating, Sarah said, and they both knew that compensating was more likely. And they were both fine with that because compensation, the quiet, unglamorous work of fixing what you can and adjusting to what you can't, was the job in its most fundamental form. At the end of the shift, she changed in the locker room and retrieved her coat, and on the way out she passed the board where the patient census was listed. The same board she had passed 6 weeks ago on the night everything changed and had not yet changed. The night a dying man whispered a word into the cold air of a trauma bay, and something in her chest had gone still in listening. She stopped at the board. Not for long. 30 seconds, maybe less. She was not the same person who had stood here 6 weeks ago, and she was completely the same person, and both of those were true simultaneously in the way that most true things are complicated, layered, resistant to the clean summary. She had hidden something she was. She had also built something she was. The hiding was over, not because she'd been exposed, but because the reason for it had changed, because she had made a different choice about what she was protecting and why, because she had looked at the situation and done the math and decided that the math pointed somewhere new. She was Sarah Novak. She was also someone else, and the someone else had a file now, and a documented record, and a name in a congressional committee report, and none of that was going to change what she did on Thursday morning when she came back from Portland and clocked in for her shift. She was going to check the IV line in room 3. She was going to correct whatever number was wrong and whatever chart hadn't been followed up on. She was going to be present in the specific and irreplaceable way that presence matters, for the people who came through the door at their worst and needed someone to see them clearly. She wasn't doing it because she'd been recognized. She'd been doing it before anyone knew to look. She'd be doing it long after the newspaper stories were archived and the Oversight Committee report was filed, and the name on the badge meant something different to the people around her than it had a month ago. That was the thing nobody could give her and nobody could take. Not Stahl with his incident reports, not the organization that had erased her file, not the 4 years of chosen smallness or the 1 week that had unmade it. You do the work because the work is real. You keep doing it because the work keeps needing doing. And if you're very fortunate, somewhere in the long middle of it, you stop needing anyone else to tell you that it matters. Sarah Novak walked through the hospital's front doors and into the December cold, and the city was lit and ordinary around her. And somewhere across town, a bus was running behind schedule, and she had a flight in the morning and a shift on Thursday and a supply cart with a bad wheel that someone was going to have to compensate for. She put her hands in her pockets. She walked toward the bus stop, and she was not hiding, and she was not waiting, and she was not small.